We start with breaking news. President Trump doubles down in his battle against Obamacare with a pair of major blows to the Affordable Care Act.
It could throw insurance marketplaces into chaos. KCAL 9 political reporter Dave Bryan is here with the latest developments. And Dave, this has to do with the federal subsidies, is that right?
Two pieces here, right? One is the executive order that the president released earlier today. We'll talk about that in just a moment. The second part is cutting subsidies now to low-income participants in the Affordable Care Act. This is a developing story tonight. Just a short while ago, the Washington Post reporting that President Trump will end cost-sharing Affordable Care Act marketplaces. The Post says the president is throwing a bomb, that's a direct quote, into the insurance marketplaces by choosing to end critical payments to health insurers that help millions of lower-income Americans afford coverage. Just a few moments ago, I spoke with Anthony Wright, the executive director of Health Access California. That's a patient advocacy group. And here's what he said about this reported action by the president tonight.
You know, a lot has been talked about the president committing sabotage on the Affordable Care Act, but that implies a hidden motive or agenda. This is the president taking a baseball bat and swinging it around a china shop. This is deliberate, this is wanton, and this is without any policy rationale.
This is going to be something that millions and millions of people will be signing up for, and they're going to be very happy. This will be great health care.
President Trump signed an executive order Thursday directing federal agencies to eliminate many regulations and allow bulk sales of cheaper health care plans, in some cases with sharply diminished coverage. The president sold it as a far superior option to Obamacare at much lower prices.
The competition will be staggering. Insurance companies will be fighting to get every single person signed up.
But some critics charge that while the president's plan will be very cheap and cover very little for young, healthy people, it could be a total disaster for those who need medical attention.
Unfortunately, this brings us back to the old days where the insurers compete and profit based on who can most deftly avoid people who actually need care. And it gives them the tools to do that by trying to sell coverage that does not meet basic coverage standards and doesn't cover key benefits.
Several Republicans believe the Trump plan is what Americans have been waiting for because they say it cuts out coverage regulations and rules and allows small businesses to create associations that will buy health care coverage for their workers at a bulk discount, like the big companies.
This is something good today, expanding health associations.
This is sort of the deregulation and the right sizing of our regulations of health care. We think the Obama administration went too far on the regulatory front. This is meant to address that.
Democrats have a very different take on the Trump health care order.
It is a sabotage of the Affordable Care Act and, quite frankly, a real disservice to the American people, many of whom voted for him.
California's insurance commissioner, Dave Jones, released a scathing review of the Trump plan that would allow insurers to sell across state lines and avoid tougher medical coverage standards in some states. He wrote, if cross-border sales are permitted without complying with state laws, it would promote a race to the bottom, where insurers choose to incorporate in the state with the weakest laws and requirements, providing the fewest benefits and skimpiest consumer protections, and then selling those products to consumers in other states, regardless of those states' laws. Now, more on the headline tonight. The Washington Post reporting that as early as November, just a few weeks from now, President Trump will shut down federal subsidies that help low-income Americans buy Obamacare policies. And with the new enrollment period for the Affordable Care Act set to begin in just a few weeks, this could create chaos in the health insurance industry. But patient advocates told me tonight the impact of this action by President Trump will not be as dramatic for covered California participants, because they say that group has already negotiated a settlement with the insurance industry that will protect consumers. Jeff, back to you.